Muscles, nerves to the muscles of the lower back, nerves to the joints, the zygapophyseal facet joints in the lumbar spine, nerves to the joint capsules of the lumbar spine, the fascia of the lumbar spine, nerves to the skin of the lumbar area. They're all branches, they're all off the medial and lateral branch of the primary dorsal ramus of the low back. Like to stretch those nerves as well. There's no reason why they can't have non-vascular edema, which I believe they do. The reason why I say that is because when I stretch these little nerves and muscles, quite often the back pain will go away. This procedure works really well. So we're going to stretch the nerve long axis. We're going to long axis stretch the nerves. And by stretching this nerve, you're kind of going to stretch the muscles. So we're looking at semispinalis, we're looking at rotatories, we're looking at quadratus lumborum. Head up now. And this is the area. Now I'm tractioning with my body. I'm tractioning her this way, and some torque. Feel that stretching in there? Mm-hmm. Always get the feedback from the patient. Pressure on, pressure off. Pressure on, pressure off. I could do some PIR. For example, try and pull back now, and relax. Pull back now, and relax. Excellent procedure. We're going to do, I normally do these procedures 4 or 5 times, and I always ask how the patient is doing while I'm doing it. Feel okay? Mm-hmm. Can I do it one more time? Yep. Okay, head up now. And head back. Now you can appreciate, I'm getting the traction in the lumbar spine, but if I change the traction somewhat, if I change the positioning somewhat, we could move a little higher up the spine. The dorsal primary ramus, of course, do all the muscles in the back. So if I want to stretch them a little higher up, I move the belt up a little more. Change the angle of the twist. Now she feels it in here. Feel it in there?
Yep.
Got to be careful of the abdomen on this one, though. Again, very effective procedure. Dorsal primary ramus, we're going to move into the upper thoracic spine. I mentioned it in another clip, to get this chronic pain back there that just seems to stay no matter what you do. Put your arms down for me. I'll get you to hold the arm for me, okay? And pressure up, pressure down. It helps with her here. You can do it without, but it helps with her here. She's pulling down, and I'm pulling up. You okay? Mm-hmm. Feel it stretching in there?
Yep.
Now, it's hard to tell where the end range is unless the patient says so. It's not, they say you can feel the end range. I'm not so sure. The patient's the one that says that's enough. So could we have gone more at that time?
Maybe a little bit.
So I wouldn't be able to tell unless I asked her. And with this particular procedure, it's surprising how much force you can use. So she's the one that tells you, is it okay? And I asked her actually during the procedure. You okay with that?
Yeah.
Can I go a little more?
A little.
I'm actually asking her during the procedure.